And then last but not least, we have our expert presenter today, Lisa Renee Holderby-Fox, who is the Director of Health Engagement at Roster Health. And I will let her take over the presentation here and complete her introduction.
Good morning, everyone. And
good morning, thank you.
Let's see. Before I jump in, I just want to tell you a little bit more about myself. As Brian said, my name is Lisa Renee Holderby-Fox. I have been a community health worker for the past 30 years. I currently am residing in the very healthy state of Georgia, and I say that tongue-in-cheek. And I'm originally from Massachusetts, so I've spent a lot of time in New Hampshire with the CHWs there, and it's actually been very exciting for me to watch the movement grow in New Hampshire. And so with that, I'm going to go ahead and start. I want to let you all know that I have no conflict of interest to disclose. So I'm going to talk a little bit about CHW core roles and skills. And particularly, I'm going to focus on what's happening now during COVID and what we can contribute to the response afterwards, after COVID-19, or after we get past this initial difficulty that we're in, because I don't think COVID's going to go away. So I wanted to start with leveling the playing field and making sure that we all had a good understanding of who community health workers are. And so what you're looking at is the definition that was developed and then adopted by the American Public Health Association. It is also adopted by many CHW associations, networks, coalitions across the country. And so I just wanted to make sure that we're all looking and understanding the same thing about CHWs. And in particular, what I'd really like to do is call your attention to our role as a liaison, a link, and an intermediary between health and social services and the community. We're that bridge that makes sure that the community is getting the information that they need, but our bridge goes both ways. And so we're also making sure that providers and healthcare providers all know what the community needs are and can adapt accordingly. So in 2018, the Core Consensus Project released its final report. And that report really talked about what the core competencies of community health workers are today, what skills we need, what our roles are, and it actually took a deeper dive and looked at some sub-roles. Dr. Lee Rosenthal led this project, and many of you may be familiar with her name. She also did the 1998 Community Health Advisor Study. That was the first study to take a look at our core competencies as a workforce. What I want you all to know here is that our core competencies really haven't changed a whole lot in 20 years. For those that are familiar with the 1998 study, you may notice that research and evaluation was not included, nor was knowledge base. And those two things were included in this more recent report because that's what we heard from CHW associations, networks, coalitions across the country, that we were having more engagement with research and evaluation, and we wanted to call that out. Around the knowledge base, that's always been there, but now it's called out by itself. And that is really additional knowledge around health-related topics. Could be chronic disease, such as diabetes, but it also could be things like homelessness, food security, capacity building in communities. So I just wanted to share that with you. And again, to note that in 22 years, not a whole lot has changed, right? We're still doing the same work we were doing 22 years ago. And in fact, I wasn't engaged, 50 years ago, 100 years ago, but I'm sure that our core roles are pretty much the same as they were then. So I wanted to talk a little bit about CHWs and infectious disease, and particularly because of where we are right now. And we can all agree that COVID-19 has turned our world upside down. However, it's really also highlighted the need that many of us doing work in communities have seen over and over again. And that's the need to make sure that our communities get information, correct information from trusted resources, community health workers. And I have to say that I'm really thrilled that we've been recognized the past couple of months. The first time I heard us on MSNBC, somebody mentioned community health workers on MSNBC, I thought I was going to fall off my chair. I was so excited. I looked at my husband, who's also a CHW, to make sure I heard what I thought I heard, and he heard it too. But I will say since then, not a month has gone by that someone hasn't mentioned community health workers on many of the news channels. It doesn't matter what news channel you're looking at, because people are really understanding the crucial role that we can play specifically around infectious diseases. And I think, the other thing to really pay attention to a little bit here is that this is not an exhaustive list of infectious diseases that CHWs have had a role in either preventing or reducing. But I do want to call out that you'll notice some of these infectious diseases we don't necessarily hear much about here in the States. So I want to say that there are some other countries that were far ahead of the curve in recognizing the value that CHWs can have. And then I also want to point out that here in the States, particularly past 20 years or so, maybe even a little bit longer, but around HIV and AIDS, CHWs have been working in this realm for a very long time. And they were almost those CHWs working in isolation because there weren't other infectious diseases getting quite as much attention here in the States that were engaging CHWs. So I want to call us back just for a moment to the skills that I kind of laid out before and take a look at how we're utilizing those skills today in the midst of COVID-19 and how we're going to use those skills afterwards. We're going to use the same skills that we've had, but the differences now are that we're going to be doing things like conducting telephonic outreach. We're going to do things like education around preventing the spread of COVID-19. What does shelter in place mean? It's interesting that the rest of the country is really kind of moving away from shelter in place. And here in Georgia, for those who don't know, the mayor of Atlanta reissued a shelter in place for Atlanta. Unfortunately, it's only Atlanta, so we've got the rest of the state that's kind of coming and going. But we're also really connecting individuals to needed resources, just like we always have. But now we know many more people are out of work. Many more people are finding themselves in need of food and other basic necessities. And CHWs are still making sure those folks are connected to those things. We're also spending a lot of time advocating. We're advocating for the needs of communities so that they can be better prepared in the future should we be in a situation like this again. And then finally, advocating for those resources to continue to be pumped into communities, right? This isn't a one-time, one and done, where we can give communities resources and move on. And our role as CHWs, in part, is to make sure that those resources continue to come and that we can continue to advocate. And I'm sorry, I know I'm going through a lot of information very quickly, but I want to make sure that we have lots of time for the discussion that we need. The other thing I want to say is that CHWs are also assisting to identify some trends as they come and go, again, because we're talking to folks. We might not be face-to-face in their homes with them at this moment, but we're still connecting. So that leads me to talking to the expansion of technology. And I'm just going to do this just for a few minutes, but I wanted to highlight a couple of things. We all know that since March, the use of technology, particularly around care and services, has increased. But what we've also noticed is the same communities that were in need before COVID-19 have greater need now. And not only do they have greater need now, but many of those communities don't have access to broadband internet. And they also, many of the individuals in those communities may not have access to devices that allow them to connect the way that we're connecting today with their providers and with CHWs. So we're using much, much more technology to get our work done. But I also want to say that this may mean that we need additional learnings as a workforce, not necessarily new skills, but new learnings. And so I want to take just a few moments to talk a little bit about some work that my organization is doing in Arkansas. We're a small startup organization, and we were just kind of taking off as COVID hit. And so a lot of our work was out and about talking to people across the country. We could no longer do that. So we had some time on our hands and we had some resources. And so we tried to think of where could we be of assistance. I picked up the phone, spoke to a colleague in Helena, Arkansas, and said to her, you know, we've got some time, some resources. What can we do to assist you? What do you need? For those who don't know, Helena is a very rural area in the Delta of Arkansas, very limited resources. And as I just said, much of Helena and the surrounding towns have very little or limited internet access. So the things that she said to me that they would like to have: a resource directory. Their current resource directory, like many CHW programs, was in a binder that was in the office. So if they were out in the field, needed resources, they had to call into the office and speak to somebody. She wanted to know if we could digitalize her directory. So we were able to do that for them. We digitalized their directory and taught the CHWs how to go in and make edits, add resources, etc. In addition to that, we also knew that they didn't have the tools needed to be able to do that work in the community. So we were able to supply them with tablets. Those tablets have hotspots so that they can access internet as needed. What I will also say that she asked, how can CHWs continue to connect with the folks that we're working with? So fortunately, we're able to donate enough tablets that some can be for CHW use and some can be for community member use. So that the CHWs are actually still able to have some FaceTime with their people that they're working with in the community. And they're doing that by dropping those tablets off safely, cleaning them off when they're done, putting them back into their bags, and then taking them to the next home. The last thing that they asked for was how could we connect our folks to their healthcare providers. There's a small practice that most of the people in the community utilize, but that practice wasn't set up for telehealth, and again, people didn't have the devices that they needed. So we were able to work with this provider. We set them up with telehealth, gave them some training, did some co-training with the CHWs and the provider, and now they're set up to do telehealth visits in addition to the other things that the CHWs were doing with their new technology ability. And so I just kind of want to end by saying new competencies are not needed. Again, new competencies are not needed. What we do need are additional skills and partnerships to enhance the value that CHWs can bring into this new reality that we're all living in. The core of our work continues to remain the same. We meet people where they are to improve overall health and promote social justice. And with that, I'm going to stop so that we can go into the next portion of our time together.
Thank you so much, Lisa.